And so the question that many patients may be asking when they're coming in here is ultimately, what is STRIVE going to be able to do to allow them to eliminate this disc herniation, not for only the moment that we're in, but down the road. So we're not worried about recurrent episodes of this or having lingering effects that impact their daily life. So it's always important I let all my patients know that there's a few components that it can really help. First off, when we're looking at everything we're doing from the exam to the x-ray to the trial treatment, putting all that in a blender and making your curated treatment plan to get you from point A to B, making sure that we're adhering to those treatment plans. With that said, being able to make it to all the appointments where we can do these great therapies such as the adjustments, the piezo with the decompression that help massively with not only reducing that herniation itself and taking inflammation from that area, but actually creating lifelong function for the long term. Alongside with that, the home recommendations. I know it's one of the things that people lack the most on, but it's probably the one thing that's going to drive a lot of these results home at the end of the day. Because look at it this way, you only get to spend so much time in the clinic here, upwards of 30 minutes for most people, but you have the rest of 24 hours, how many days throughout the week that you're on your own being able to commit to some of these things. So again, using the treatment plan that's curated for each patient, depending on where they're at, coming in for the clinical treatments and receiving some of the higher tech treatments that we have available, but also making sure you're taking the time to create the habits to enact these sustainable changes for the long run. And by doing so, now we can talk about eliminating these things completely.